Tell me if this sounds like you. You sit down for dinner, 30-40 minutes. You go to stand up and your leg isn't really there. It's numb from the hip to the knee, that heavy dead weight feeling that makes you grab the edge of the table just to stay upright. Or maybe yours hits differently. A sharp shooting pain that fires from your lower back down through your buttock, down the back of your thigh. Like somebody flipped an electrical switch without warning. You shift around, you stretch, you walk it off, and it comes right back. You went to your doctor, they took an x-ray, maybe an MRI. They told you there's some disc degeneration, some narrowing, some wear and tear, and that for your age, this is pretty standard. Maybe they gave you a pain prescription, maybe a physiotherapy referral, maybe they just said the word sciatica and told you to manage it. What they almost certainly did not say, and in 20 years of practice I've almost never seen it written in a referral letter, is this. Your sciatic nerve may be breaking down not because of your spine, but because of a deficiency so specific that routine blood tests miss it almost every time. A deficiency in the active form of a vitamin that nearly every person over 60 is either failing to absorb or supplementing with the completely wrong version. I'm Dr. Frank Castle. I practice integrative and functional medicine, and I've spent the better part of 12 years working with adults over 60 who were told their sciatica, their leg numbness, their shooting pains were structural problems, bone and disc issues. When the real problem was that the nerve itself was starving for something very specific, something that can be fixed. That's what we're getting into today. Before we go further, drop a comment right now, your age, where you're watching from, and one word for your leg: burning, numb, shooting, heavy. Just one word. I go through every single comment. And if you're not subscribed yet, now's the time. We go deep on exactly this kind of thing every week. Let me walk you through what's actually happening inside your leg. And I want you to really picture this, because once it clicks, everything else falls into place. Your sciatic nerve is the longest nerve in your body. It starts at your lower spine, runs through your pelvis, down the back of each thigh, all the way to your feet. Think of it as a major highway, a 6-lane motorway carrying signals back and forth between your brain and your legs. Every sensation you feel down there, every movement, every instruction your brain sends to your lower body travels along this road. Now, like any highway, this nerve has a protective barrier around it, an insulating layer called the myelin sheath. When that sheath is thick and in good shape, signals travel at full speed with no interference. When it starts thinning, when it starts cracking and breaking down, traffic slows. Signals get garbled. Some never arrive at all. And what does that feel like from your end? Numbness, tingling, that electric shooting pain, the heavy disconnected leg that doesn't feel like it belongs to you. Here's the question that nobody seems to ask. What keeps the myelin sheath intact? The answer is vitamin B12, specifically a form of B12 that your nerve cells can use directly. B12 is the main raw material your body relies on to build and continuously patch that protective coating. If there isn't enough B12 getting to the cellular level, the myelin sheath can't repair itself. It gets thinner, it develops cracks, and your sciatic nerve, the longest, most exposed nerve you've got, is one of the first things to pay the price. Now here's why this becomes a much bigger deal after 60. First, your stomach makes a protein called intrinsic factor, basically the escort that B12 needs to get absorbed from your gut into your bloodstream. After 60, intrinsic factor production drops off noticeably in most people. Less escort means less B12 getting through, no matter how much you eat or how many pills you take. Second, and this one genuinely bothers me, if you're on metformin for blood sugar, you need to hear this. Multiple peer-reviewed studies have shown that metformin actively depletes B12 by messing with intrinsic factor absorption. If you've been on it for more than 2 years, there's a real chance your B12 is lower than it should be, even if your last blood test came back normal. Because standard blood tests measure total B12 floating around in your blood. They don't tell you whether that B12 is actually making it inside your nerve cells where it's needed. Third, the form. And this is where things change. Let's get into what your sciatic nerve actually needs, and why whatever's sitting in your medicine cabinet right now is almost certainly not getting the job done. The first one is methylcobalamin. Methylcobalamin is the neurologically active form of vitamin B12. It's the form your nerve cells can pick up and use immediately, no conversion needed. It's the form that crosses the blood-nerve barrier and participates directly in myelin synthesis, in actually rebuilding that protective sheath around your sciatic nerve. The form you'll find in almost every standard supplement out there, every budget multivitamin, every generic B complex sitting on the pharmacy shelf, is cyanocobalamin. That's a synthetic version of B12 that your liver has to convert before your body can do anything with it. In a young, healthy liver, that conversion works well enough. In a liver that's been running for 60, 70 years, often juggling cholesterol meds, blood pressure meds, acid reflux meds all at once, that conversion gets seriously bottlenecked. You could take cyanocobalamin every single day for a year and your sciatic nerve might see almost none of it. The dose that actually produces results, the dose I use with patients who are in active nerve recovery, is 1000 to 1500 micrograms of methylcobalamin daily. And here's the detail that makes or breaks it. Take it sublingual. That means it dissolves under your tongue. This route skips the gut completely. No intrinsic factor needed, no stomach acid required. The B12 absorbs straight through the tissue under your tongue into your bloodstream. For anyone over 60 whose absorption is compromised, sublingual methylcobalamin isn't a nice to have, it's the delivery method that actually works. The second is R-alpha lipoic acid, and I mean the R form, not the generic ALA blend you'll find in most products. Alpha lipoic acid is unusual among antioxidants because it's both fat and water soluble. That means it can get through nerve cell membranes and clean up oxidative damage happening inside the cell, the kind of damage that piles up over years of inflammation, blood sugar fluctuations, and poor circulation to the nerve. 300 to 600 milligrams a day, taken on an empty stomach or about 30 minutes before a meal for the best absorption. The third is vitamin D3, not D2, not ergocalciferol, but cholecalciferol, the form your skin would naturally make from sunlight. There are vitamin D3 receptors throughout the nervous system, and deficiency, which is extremely common in adults over 60, especially those who don't get much outdoor time, is directly associated with increased nerve pain sensitivity and slower nerve repair. 3000 to 5000 IU daily, always taken with your biggest meal since D3 is fat soluble and needs dietary fat to absorb properly. These three work together as a system. Methylcobalamin rebuilds, RALA protects, D3 regulates. Pull any one of them out and the other two become significantly less effective. Let me tell you about a patient named Robert. Robert was 72 when his daughter brought him to my clinic. She'd driven him there because Robert had stopped driving himself about 6 months earlier. Not because of his eyes, not because his reflexes were shot, because getting into and out of the driver's seat had turned into an ordeal. The second he sat down and bent at the hip, a shooting pain would fire from his left buttock straight down the back of his leg, and the way he described it was like someone dragging a hot wire through my thigh. He'd been diagnosed with sciatica 4 years prior, did physiotherapy, 12 sessions, got some improvement, then hit a wall. Tried 2 different pain medications after that. One gave him brain fog so bad he said it felt like living inside a fishbowl. The other one did nothing at all. His spine specialist had floated surgery as a future possibility. Robert decided he'd rather just live with the pain. He showed up at my office because his daughter had watched a video a lot like this one. Robert had been on metformin for 9 years. His most recent blood work showed B12 at 280 pmol, technically within normal range. But here's the thing about normal range. Most lab reference ranges are set for the general population. They're not calibrated for a 72-year-old man who's been on metformin for nearly a decade and has active nerve symptoms. In functional medicine, anything below 500 pmol is considered potentially inadequate for proper neurological function. Robert was sitting at 280. We started him on sublingual methylcobalamin, 1500 micrograms every morning, RALA at 600 millimoles total, split into 2 doses before meals, D3 at 5000 IU with dinner. I told Robert what I tell every patient who starts this. The first thing you'll probably notice isn't an improvement, it's a change. The pain might shift in character before it drops in intensity. That shift means the nerve is starting to respond. Day 14, Robert called me. He said the shooting pain was still happening, but it was, and this was the word he used, shorter. The electric fire running down his leg used to last 20, 30 seconds every time he stood up. Now it was lasting 5 or 6. Same nerve, different behavior. That's myelin starting to come back. At 6 weeks, his daughter called on his behalf. She said he'd walked to the end of the street and back, something he hadn't done by himself in over a year. He wasn't pain-free, but he was moving. He was choosing to move, and that is a completely different life than the one he'd been living. At 3 months, Robert drove himself to his appointment. He sat down in the chair across from me and said something I've thought about many times since. He said, "Nobody ever asked me what kind of B12 I was taking, not once in 4 years. That's why I make these videos." Here's the protocol. Write it down or bookmark this video. Step 1. Find out what B12 you're on and switch it immediately. Check the label on every B vitamin supplement you're currently taking. If it says cyanocobalamin, stop taking it. Replace it with methylcobalamin in sublingual form, 1000 to 1500 micrograms, under the tongue. Hold it there for about 30 seconds before swallowing, every morning. For a lot of people, this single change is enough to start shifting things. Step 2. Add R-alpha lipoic acid, 300 mg before breakfast, 300 mg before dinner, 600 mg total per day. Take it on an empty stomach or at minimum 30 minutes before eating. On the label, look specifically for R-ALA or NAR-ALA. If it just says ALA with no qualifier, it's a 50-50 blend that includes a synthetic mirror image compound which dilutes the effective dose. Step 3. Add vitamin D3. 3000 to 5000 IU with your biggest meal of the day. If you haven't had your D levels checked recently, ask your doctor to add it to your next round of blood work. The target blood level for good nerve function is 50 to 70 ml. A lot of adults over 60 come back below 30. Step 4. If you're on metformin, bring this up with your doctor. Ask specifically for a functional B12 workup. Not just total serum B12, but methylmalonic acid and homocysteine levels. Those are the markers that actually show whether B12 is doing its job at the cellular level. Any doctor can order these tests. Most just don't think to unless somebody asks. Step 5. Understand how long this takes and don't bail early. The sciatic nerve is long. Myelin repair is slow by nature. In the first couple of weeks, watch for changes in how the pain behaves, how long it lasts, how sharp it is, how often it shows up, not necessarily whether the overall intensity has dropped yet. By week 6, if you've been consistent, most people notice real functional improvements, walking further, sitting longer, sleeping better. 3 months of steady use is what I consider a fair trial. Don't quit at week 2 because you were expecting week 8 results. A few important things before I let you go. If you're on blood thinners of any kind, talk to your doctor before adding high-dose B12 or alpha-lipoic acid. If you have kidney disease, D3 above 2000 IU needs medical oversight. Too much D3 can throw off calcium metabolism when the kidneys aren't working right. If you're on epilepsy medication, alpha-lipoic acid has known interactions that are worth running past your neurologist. And if your leg symptoms came on suddenly, especially if there's weakness involved, any change in bladder or bowel control, or you can't lift your foot, get to a doctor quickly. Those can point to a structural problem that needs urgent attention, and supplements aren't the answer there. For everyone else, I want to leave you with this. The sciatic nerve that's been making your life miserable for years is not destroyed beyond repair. It's a living structure. It responds when you give it the right environment. Hand it the building blocks it's been missing. Be consistent about it. Give it time and stop accepting that's just your age as an answer, because it's not an answer. It's a brush off. You deserve better than that. If this helped you, send it to someone who's going through the same thing right now. They've probably been told what you were told. They deserve to hear that there's a different path. Leave a comment, your age, your country, and whether Robert's story hit close to home. I read every one of them. Subscribe so you catch what's coming next. Take care of yourself. I'll see you in the next video.